Welcome back to the Business Spotlight. I'm Pat Dewar. Today we're talking with Dr. Mary Swift about, well, losing your teeth, or maybe I should say helping you keep your pearly whites. Dr. Mary, we talked about last time, my dad lost his teeth early, in a sense, 40-something, 48.
That's early.
Is that something you see very frequently today?
Less and less, and that's the good news. My profession has done a really good job over the last 50 years of promoting preventive care. I mean, the oral health, over-the-counter, grocery store, drugstore industry is huge. I mean, everyone wants the products and the magic bullet to, you know, freshen their breath and clean their teeth. So I love that. I love that we're all aware of our teeth and our smiles. But the number one reason for tooth loss is gum and bone disease, and it's so silent. It's a slow, progressive, silent disease that sometimes people don't even know that they have bone loss around their teeth until it's too late. There was an ad in the 50s about pink in the sink. If you brush your teeth and you rinse and you spit out and there's a little blood in the sink, you know, something's wrong. If you washed your hands and there was blood, you'd be looking for something wrong.
Yeah,
okay?
Exactly.
So it's like the number one, you know, something's going on clue is a little pink in the sink. Now, the gum and bone disease that is so silent and so destructive is the primary reason why people lose their teeth, okay? Sometimes it's decay, but realistically we can remove decay, fill it, and fix it.
Right.
Gum disease is entirely different.
So what do you do for gum disease?
It's like being a diabetic. You
Right.
literally have to modify your lifestyle, make some changes to improve the chances of keeping your teeth and battling this gum and bone disease.
Changes. What kind of changes?
Cleanings by a professional hygienist 3 or 4 times a year.
Really?
Yes.
Really?
That when you have bone loss, your gums are staying where they've always been, but silently the bone is creeping down the tooth. You can't reach that. Your toothbrush is on the
I see.
above
So the
the
gum
gums.
is hanging over, in a sense. It's kind of like
it takes
our bellies.
our little instruments to get in there and clean it up. It's all about bacterial count. It's all a numbers game.
Oh.
The more often it's like if you were a diabetic, you had an open wound, that wound requires more care to heal, okay?
Right.
So you've got nooks and crannies that you can't reach that the professional can, to keep the numbers down, to slow, I'm not even talking stop, the progression of bone loss. So it is unfortunate, but if you have a tendency towards gum and bone disease, you have to actively battle. Yes, like your waistline. I heard you.
Well, it's that whole thing. You know,
things.
it's kind of hanging over there, but it's just that it's getting. Is it a? It's just loosening. What's happening?
And it's truly. And they're working on a vaccine. If you can, I mean,
Nice.
because it is a bacterium, a specific bacterium. Everybody has it. It's just that if you have a tendency towards gum and bone disease, you're more sensitive to it and it does more damage. So it is about controlling that bacterium in your mouth.
You can become a published author. Discover a system that will lead you from idea to having your book on the bookshelves. Bob Baer pulls back the curtain at the More Power to Publish workshop. Watch and learn how to follow the step-by-step plan to turn your idea into a published book. Learn more at morepowertopublish.com.